Human metapneumovirus, or hMPV, has been making headlines lately, and for good reason. This virus, although not new, has recently seen a significant increase in reported cases, drawing the attention of both the public and the medical community. This respiratory virus isn't new to the medical community, but its recent surge in cases, particularly in China, has raised concerns. Hospitals are seeing an influx of patients, and healthcare workers are working tirelessly to manage the situation. hMPV is a common respiratory virus that was first discovered in 2001. Since its discovery, researchers have been studying its behavior, transmission, and impact on human health. It's part of the same family as the viruses that cause measles, mumps, and respiratory syncytial virus, or RSV. This family of viruses is known for causing respiratory infections, which can range from mild to severe. While hMPV can affect people of all ages, it tends to be more severe in young children, older adults, and individuals with weakened immune systems. These groups are more susceptible to complications and require closer medical attention. The virus spreads through respiratory droplets, much like the common cold or the flu. When an infected person coughs, sneezes, or even talks, tiny droplets containing the virus can be inhaled by others nearby. This means that it can be transmitted through coughing, sneezing, or even talking. Close contact with an infected person increases the risk of transmission, making it important to practice good hygiene and social distancing. hMPV often presents with mild, cold-like symptoms, making it difficult to distinguish from other respiratory illnesses. Symptoms can include a runny nose, cough, sore throat, and fever. However, in some cases, it can lead to more serious complications, such as bronchiolitis or pneumonia, especially in vulnerable populations. These complications can require hospitalization and intensive medical care. The recent surge in cases has put a strain on healthcare systems, particularly in China, highlighting the importance of understanding this virus and taking necessary precautions. Healthcare workers are under immense pressure, and hospitals are struggling to keep up with the demand for care. Researchers are working diligently to develop vaccines and treatments for hMPV. While there is currently no specific antiviral treatment for the virus, supportive care and preventive measures can help manage symptoms and reduce the spread. Public health campaigns are emphasizing the importance of wearing masks, practicing good hand hygiene, and maintaining social distance to prevent the spread of hMPV. These measures are crucial in protecting vulnerable populations and reducing the overall impact of the virus. Community health workers are playing a vital role in educating the public about hMPV and distributing hygiene kits to those in need. By following health guidelines and staying informed, we can all contribute to controlling the spread of this virus. Despite the challenges posed by hMPV, there is hope. With continued research, public cooperation, and the dedication of healthcare professionals, we can overcome this surge and protect our communities from future outbreaks. hMPV is a master of disguise, often mimicking the symptoms of the common cold. This virus can easily be mistaken for other common respiratory infections, making it a challenge for healthcare professionals to identify it accurately. This can make it tricky to diagnose, as its symptoms often overlap with other respiratory illnesses. Doctors must rely on a combination of patient history, physical examination, and sometimes specific tests to pinpoint hMPV. The most common symptoms of hMPV include a runny nose, cough, and fever. These symptoms are often mild at first, but can escalate, leading to more discomfort and concern. These symptoms typically appear 1 to 5 days after exposure to the virus. The incubation period can vary, making it difficult to trace the source of infection. In some cases, hMPV can also cause sore throat, headache, and muscle aches. These additional symptoms can further complicate the diagnosis, as they are common to many other illnesses. Infants and young children may exhibit additional symptoms such as wheezing, difficulty breathing, and a decreased appetite. These symptoms can be particularly alarming for parents and caregivers, necessitating prompt medical attention. While most people recover from hMPV within a week or two, some individuals may develop more serious complications. Recovery times can vary based on the individual's overall health and the severity of the infection. These complications are more likely to occur in young children, older adults, and people with weakened immune systems. For these vulnerable groups, hMPV can lead to severe respiratory issues, requiring hospitalization and intensive care. It is crucial to monitor symptoms closely and seek medical advice if they worsen. hMPV is highly contagious and spreads easily from person to person. The virus travels through respiratory droplets released into the air when an infected person coughs, sneezes, or talks. These droplets can then be inhaled by others, leading to infection. In addition to direct contact, hMPV can also spread through indirect contact. This means that you can become infected by touching a surface that has been contaminated with the virus, such as a doorknob or a toy, and then touching your eyes, nose, or mouth. The virus can survive on surfaces for several hours, making it important to practice good hygiene to prevent its spread. China is currently grappling with a significant surge in hMPV cases, particularly in northern provinces. Hospitals are reporting a sharp increase in patients, many of whom are children presenting with respiratory illness. Pediatric wards are overwhelmed, with some hospitals exceeding their capacity. The surge in hMPV cases has put a strain on China's healthcare system, with hospitals facing shortages of beds, medical staff, and essential supplies. The situation is particularly concerning in rural areas where access to healthcare is limited. Authorities are working to increase hospital capacity and deploy additional medical personnel to affected regions. Section 5. Echoes of a familiar foe COVID-19 déjà vu. The recent surge in hMPV cases, particularly in China, has drawn comparisons to the early days of the COVID-19 pandemic. The sudden spike in infections has led to overcrowded hospitals, with patients and healthcare workers alike feeling the pressure. The rapid increase in infections, the strain on healthcare systems, and the uncertainty surrounding the virus have all contributed to a sense of déjà vu. Healthcare workers are once again on the front lines, facing long hours and difficult conditions as they strive to care for the influx of patients. However, it's important to note that hMPV is not a new virus like COVID-19. Human Metapneumovirus, or hMPV, was first discovered in 2001 and has been known to cause respiratory infections, particularly in young children, the elderly, and those with weakened immune systems. While hMPV can cause serious illness, it generally has a lower mortality rate than COVID-19. Most people who contract hMPV experience mild to moderate symptoms, similar to those of a common cold or flu, and recover without the need for hospitalization. Additionally, unlike COVID-19, there are currently no specific antiviral treatments or vaccines available for hMPV. This lack of targeted treatment options means that healthcare providers must rely on supportive care to help patients manage their symptoms and recover. However, the similarities in the way both viruses spread and the challenges they pose to healthcare systems serve as a reminder of the importance of public health preparedness and the need for ongoing vigilance. The experience of the COVID-19 pandemic has underscored the necessity of having robust healthcare infrastructure, effective communication strategies, and comprehensive response plans in place to address emerging health threats. As we navigate this new surge in hMPV cases, it is crucial to apply the lessons learned from COVID-19. Public health measures such as wearing masks, practicing good hand hygiene, and maintaining social distancing can help reduce the spread of the virus. Continued research and investment in healthcare are essential to developing effective treatments and vaccines for hMPV and other emerging infectious diseases. By staying informed and taking proactive steps to protect ourselves and our communities, we can mitigate the impact of hMPV and ensure a healthier future for all. Section 6. Stepping up to the challenge: China's response. Faced with a growing number of hMPV cases, Chinese authorities have sprung into action, implementing a series of measures to contain the outbreak and mitigate its impact. Hospitals are working tirelessly to increase capacity, setting up temporary treatment centers and increasing the number of beds available for patients with respiratory illnesses. The government has also stepped up its public health messaging, raising awareness about hMPV, its symptoms, and how it spreads. Schools and daycare centers have been advised to reinforce hygiene measures, such as frequent hand washing and respiratory etiquette. Additionally, health officials are closely monitoring the situation, tracking the spread of the virus and identifying potential hotspots. Section 7. Shielding your family. Practical tips for prevention. Protecting yourself and your loved ones from hMPV involves adopting simple yet effective hygiene practices that can significantly reduce the risk of infection. Frequent hand washing remains a cornerstone of prevention, with thorough scrubbing with soap and water for at least 20 seconds being crucial. When soap and water are not readily available, alcohol-based hand sanitizers with at least 60% alcohol content can serve as an effective alternative. Respiratory etiquette plays an equally important role in curbing the spread of hMPV. This includes covering your mouth and nose with a tissue or your elbow when you cough or sneeze, and promptly disposing of used tissues. Section 8. Navigating the surge, a doctor's advice. As a doctor, I understand the concerns surrounding the hMPV surge, especially among parents. It's crucial to stay informed but avoid panic. If your child exhibits cold-like symptoms, keep them home to prevent further spread. Ensure they drink plenty of fluids and get adequate rest. Over-the-counter medications can help manage fever and discomfort. However, consult your pediatrician before giving any medication to infants or young children. Seek immediate medical attention if your child experiences difficulty breathing, persistent high fever, or worsening symptoms.